Hello everyone, this is the last topic for Unit 5, which is handling and transporting laboratory specimens and prostheses. Okay, for specific learning outcomes, 1. Explain the principles of safe handling, internal and external transport of specimens. And number 2, describe the regulations that govern the external transport of specimens. All right, so for the introduction, we are looking at these four types or four categories of specimens or prostheses that we are dealing with to be transported outside our clinic. Okay, so the first one is blood, number two is prostheses, number three, body tissues, or the last one, any other fluid, for example, pus or even sputum. Okay, so all specimens must be considered as potentially infective and will be handled using universal guidelines. Okay, so you're looking at handling of all biohazard um, specimens or biohazard samples as described on the plastic bag here. Both are biohazard. Okay, for purpose of this lecture, we are focusing on two things, which is soft tissue, which is very common in dental clinic, and the second one is prostheses. So for the first one, soft tissue, normally we are sending this soft tissue for the histopathology examination following the biopsy procedure that we have done in the clinic. So for the soft tissue specimen, we need a plastic container, which is a leak-proof. We need a plastic bag, and then we need a transport container, which is leak-proof. So what happened in the lab, in the clinic, is we need to use this plastic container labeled with a specimen container, and then we put the medium in there, and then we can put it any of the soft tissue specimen inside and close it tight, and then put this plastic container in this plastic bag labeled as biohazard, and then this bag will be put in this transport container to be transported into the lab. Okay, if you are sending this through a mail, you have to follow the local mail regulation regarding the specimen transport. Okay, all right, for the blood, we are using this blood tubes, and then definitely the plastic bag, and then also it's the same thing, transport container. So after taking the blood, these bottles or these tubes need to be put into the plastic bag labeled as biohazard, and then this plastic bag will be put in the transport container for the transport. Okay, so that is for the blood specimen. So, as for the flow, to summarize, sending the biological specimen, which is considered as biohazard, the first one is just put on the PPE accordingly. Before that, do the hand hygiene, place specimen in the appropriate container and put in the first bag. Secure the lids tightly to prevent leakage of the container, and then place the specimen into a plastic Ziploc type bag, the secondary bag which you have seen before, and then perform the hand hygiene, and then put in the third bag, which is the transport container, to be sent off to the lab. So we have three different types of package, which is the first bag, second bag, and the third one is actually the container. And then you need to observe the PPEs and also the hand hygiene in the flow. Okay, just make sure that you follow these guidelines. All right, for the prosthesis management, we are going to focus on the processes or processes related procedures or materials that we are sending to the dental lab. Okay, so for the prosthesis management, we need to assure that before sending to the lab, it has to be decontaminated first. Okay, so first one is you need to put on the PPE definitely, and then clean or rinse the impression material. For today's purpose, I'm using the alginate impression material. It can be anything. Rinse them once it's coming out from the mouth, rinse with the water, and then soak it in the appropriate disinfectant available in the clinic, which what we call it is to immerse in the disinfectant. And then this is the prostheses or the impression materials. Put it in the Ziploc type bag, okay? And if you notice, this bag is not labeled as biohazard because this processes, as you see in the previous slide, it has decontaminated by immersing in the disinfectant previously, right? Then you may put in the container. This container is not a lock container, so because it's not considered as biohazard, so you can just put the whole thing in here and send to the lab. Okay, for the transport using the mail system or using the post system, please refer to the local post office for the guidelines. Okay, so very simple how you transport the prostheses and specimen to the lab. All right. For any airborne spread disease, if it's suspected, it should be collected in a negative pressure room, which we have discussed about this before. If there is no negative pressure room, then you can actually use a room with a good air circulation or outdoors, um, or outdoors, or you just open up the windows to make sure that the circulation is in the clinic. Okay. With that, thank you.